So good morning, dear students. So we'll be continuing with this. Previous class, we had discussed about the coronary circulatory system, the hepatic portal system, then pulmonary, the double circulation. We had discussed about pulmonary and systemic circulations. Now, how is the cardiac activity regulated? What controls it? See, human heart is a myogenic heart, so it is controlled by the uh, muscular. It is a muscular heart, and the impulses are initiated by the muscles. So, medulla oblongata regulates the cardiac activity. So, the medulla oblongata, it is going to regulate the, so the cardio-regulatory center is there. It is going to regulate the cardiac activity along with ANS, that is autonomous nervous system. So autonomous nervous system, it has sympathetic and parasympathetic nerve fibers. So it is the cardio-regulatory center is located in the medulla oblongata. So in coordination with autonomous nervous system, they are going to regulate the cardiac activity. So the sympathetic nerves, so the sympathetic nerve fibers of autonomous nervous system, they increase the rate of heartbeat. Uh, they bring about the strength of ventricular contraction and cardiac output. Whereas the parasympathetic nerves of autonomous nervous system, they decrease the heartbeat, conduction of action potential, and the cardiac output. So they are going to decrease this heartbeat, decrease the conduction of action potential, and decrease the cardiac output. Whereas the sympathetic nervous fibers, they increase the rate of heartbeat, the strength of ventricular contraction, and cardiac output. So the adrenal medullary hormones. So the adrenal medullary hormones increase the rate of heartbeat, especially the epinephrine. We also call it as adrenaline, and norepinephrine is going to reduce the rate of heartbeat. So this is also done by the adrenal medullary hormones. So the epinephrine is going to increase the circulation and as well as increase the rate of heartbeat, whereas the norepinephrine, they are going to reduce the rate of heartbeat. So the next that we will discuss about is the lymphatic system. So lymphatic system includes of lymph, lymph vessels, and lymph nodes. So you can notice the lymph nodes at various lymph vessels and lymph nodes. You can notice of that of the lymphatic system. So as the blood passes through the capillaries in tissues, some water and soluble substances are filtered out from the plasma to the intercellular spaces. So some water and soluble substances are filtered out from plasma to the intercellular spaces to form tissue fluid or interstitial fluid. So the intercellular spaces are filled with this tissue fluid or interstitial fluid. It has same distribution as that in plasma. Some of this tissue fluid enters into lymphatic system, and the tissue fluid in the lymphatic system, we call it as lymph. So the tissue fluid is because of some of uh, the diffusing of the plasma to the intercellular spaces to form tissue fluid. If this tissue fluid enters this lymphatic system, then the tissue fluid is called as lymph. So it drains back to major veins. Okay, so lymph is a colorless fluid containing lymphocytes. Lymph is a colorless fluid which contains the lymphocytes. So you can notice the various lymph nodes: cervical lymph nodes, axillary lymph nodes, right lymphatic duct, cisterna chyli, very big lymph nerves. Then there is inguinal lymph nodes. So cisternae chyli, so inguinal lymph nodes. So the right lymphatic duct, left lymphatic duct, spleen is there. So the palatine tonsils, cervical lymph nodes, thymus. So you can notice this axillary lymph nodes, cervical lymph nodes, then inguinal lymph nodes, lymph ducts and lymph. Okay, lymph is a colorless fluid which contains lymphocytes. So the lymphatic system, they consist of lymph, lymph vessels, and lymph nodes or glands. As the blood passes through the capillaries in tissues, Some of water and soluble substances are filtered out from the plasma to the intercellular spaces, and they form this interstitial fluid. So this interstitial fluid, it has the same mineral distribution as that in plasma. So the interstitial fluid, they have the same mineral distribution similar to that of plasma. Some of this tissue fluid, this interstitial fluid, enters the lymphatic system, and we call it as lymph. And this tissue fluid, we call it as lymph. So it drains back to major veins. Lymph is a colorless fluid containing lymphocytes. See, from the capillaries, when the blood is passing through the tissues, some of the plasma diffuses into the interstitial cell spaces. So that the interstitial fluid, they have the same minerals as that of plasma. So this we call it as the interstitial fluid. When it enters the lymph vessels, we call it as lymph. So the interstitial uh, tissue fluid which enters the lymph, we call it as uh, lymph vessels, we call it as lymph. So they are colorless. Lymph is a colorless fluid with lymphocytes. So the tissue fluid formed, the tissue fluid which is absorbed. So you can notice that in this lymphatic system. So what is the functions of lymph? It is the middleman between blood and tissues. So lymph is a middleman between blood and tissues. So tissue fluid helps to exchange nutrients, gases, etc. between blood and cells. So that is the reason lymph is considered to be a middleman between blood and the tissues. So the tissue fluid or lymph, it helps in exchange of nutrients, gases between the blood and cells. So the lymph carries plasma proteins synthesized in liver to the blood. So the lymph carries the plasma protein synthesized in liver to the blood. So the lymph also transports digested fats through lacteals in the intestinal villi. So the lymph also uh, transports the digested fat through lacteals in the uh, intestinal villi. So you can see this tiny lymphatic vessel, so lacteals, which transports the digested fats through the lacteals in the intestinal villi. The fat soluble vitamins, hormones, etc. are transported by this lacteals. So the filtration of bacteria and foreign particles, lymph brings about the filtration of bacterial and foreign particles. So lymph node produces WBC lymphocytes as well as antibodies. So lymph nodes produce WBC and antibodies. The next final part that we'll be discussing about is uh, the disorders of circulatory system. So we'll be discussing the final part of this chapter, that is the disorders of circulatory system. So for the first disorder that we'll be studying about is hypertension or high blood pressure. So this is just a slide which you can see here. The normal blood pressure is 120 by 80. That is the normal blood pressure. So whenever so there are different stages, but I'll be giving you the exact definition here as per your NCERT books. This is the as per clinical standards, they have this. So 120 by 80 millimeter of mercury. So we call it as the normal blood pressure. So what is the instrument used to measure this blood pressure? We call it as sphygmomanometer. Okay, so the instrument used to measure the blood pressure is sphygmomanometer. To measure the rate of heartbeat is stethoscope. So this is pre-hypertension, before the hypertension. So the value ranges between 120 to 139 and 80 to 89 millimeters of mercury. The hypertension stage is above 140 to 159 and 90 to 99 of mercury. The hypertension stage 2 is 160 to 179 and 100 to 109 millimeters of mercury. The hypertensive crisis is 180 and greater than 110 180 by a bar greater than 110. So that is the millimeters of mercury. That reading is hypertensive crisis, and stroke it leads to. After this hypertensive crisis, greater than that, it leads to stroke. So nearly 220 to 135, it leads to stroke. Okay. So these are all the different levels of high blood pressure. This is only for description part of it. Please don't try to remember them for your examination. You have to remember what is given here in textual content. Okay, that is general knowledge part of it. So textual content you have to remember about. So the pressure of circulating blood on the walls of blood vessels is called blood pressure. The pressure of circulating blood that is felt on the walls of blood vessels, it is called as blood pressure. The pressure of circulating blood on the walls of blood vessels is called as blood pressure. So normal blood pressure is 120 by 80 millimeters of mercury. It includes systolic pressure, that is the pumping pressure, so which is around 120 millimeters of mercury, and diastolic, that is resting pressure, which is 80 millimeters of mercury. So normal blood pressure is 120 by 80 millimeters of mercury. It includes systolic pressure 120 mm of mercury, and diastolic pressure, that is relaxing pressure, which is 80 millimeters of mercury. So when the blood pressure is higher than the normal BP, that is blood pressure, we call it as hypertension. If an individual reportedly has the blood pressure of 140 by 90 or above, it shows hypertension. So if an individual repeatedly has the blood pressure of 140 by 90 or above, it shows hypertension. So it leads to heart diseases and affects vital organs like brain, kidney, etc. So this hypertension leads to heart diseases and it affects vital organs like brain, kidney, etc. So when the blood pressure is higher than the normal blood pressure, it is called as hypertension. If an individual repeatedly has the blood pressure of 140 by 90 or above, it shows hypertension. It leads to heart diseases and affects vital organs like brain, kidney, etc. It leads to heart diseases and affects vital organs like brain, kidney, etc. Hypertension, high blood pressure. When the blood pressure is higher than normal blood pressure, it is called hypertension. If an individual repeatedly, this I had just discussed about it, the foods to avoid during high blood pressure is avoiding salt, spicy food, meat or wine, and the alcoholic beverages. So these are all the foods which has to be avoided during high blood pressure. Rather, natural foods should be uh, gone for to lower the blood pressure. So you have the cheese or the paneers. So then you have this watermelons, potato, the beans, kiwi, passion fruit. Okay. Then the broccoli, milk, banana. So, and here you have this palm jaggery. So, they are all some of the natural foods to lower our blood pressure. So, whenever it is greater than 140 by 90 or above, so it is considered to be hypertension. It leads to heart disease and affects vital organs like brain, kidney, etc. The coronary artery disease or CAD or atherosclerosis. So, coronary arteries, so here calcium, fat, cholesterol, and fibrous tissue are deposited in coronary arteries. So, calcium, fat, cholesterol, and fibrous tissue are deposited in coronary arteries. It makes the lumen of arteries narrower. So, it makes the lumen of arteries narrower and thereby affects the blood supply. So the calcium, fat, cholesterol, and fibrous tissue are deposited in the coronary arteries. It makes the lumen of arteries narrower and thereby affects the blood supply. And acute chest pain due to that is what we call it as the coronary artery disease or atherosclerosis, wherein the deposition of calcium, cholesterol, or fat uh, and fibrous tissue. So they are going to be deposited in the coronary arteries. It makes the lumen of arteries narrower and thereby affects the blood supply. So this we call it as coronary artery disease, CAD, or atherosclerosis. Angina pectoris, an acute chest pain due to the deficiency, oxygen deficiency to the heart muscles. It occurs due to improper blood flow. It is common among middle-aged people and elderly. So angina pectoris is the an acute chest pain due to oxygen deficiency to heart muscles. It occurs due to improper blood flow and it is common among middle-aged and elderly people. Next is the heart failure or congestive heart failure. It is the inability of heart to pump blood enough to meet the needs of the body. So heart failure or congestive heart failure, it is because of the inability of heart to pump blood enough to meet the needs of the body. So heart failure is the inability of heart to pump enough blood to meet the needs of the body. Congestion of the lungs is the main symptom for this heart failure. So congestion of the lungs is the main symptom for this heart failure. So the inability of heart to pump blood enough to meet the needs of the body is called as heart failure or congestive heart failure. Congestion of the lungs is one of the main symptoms uh, of this heart failure. So cardiac arrest, so the heart attack, always there is a difference between that. Many times we confuse between them and interchange the names. So cardiac arrest is an electrical problem. So whereas the heart attack is a plumbing problem. So it is because of the blocked artery. So here in cardiac arrest, the heart stops beating. So in cardiac arrest is an electrical problem wherein the heart stops beating. Okay. Heart attack, it is, as I told you, it is a plumbing problem. It is the sudden damage of heart muscles due to the inadequate blood supply, and that might be because of plaque formation in the coronary arteries, and there is a blocked blood flow. So it is the sudden damage of heart muscles. Heart attack is the sudden damage of heart muscles due to inadequate blood supply. Heart attack is the sudden damage of heart muscles due to the inadequate blood supply, and that we call it as heart attack. So there's a plaque formation and there is a blocked blood flow in the coronary arteries. So once there is no uh, supply of the blood from the coronary arteries, the sudden damage of heart muscles due to inadequate blood supply, we call it as heart attack or myocardial infarction. So the cardiac arrest is an electrical problem, whereas the heart attack is a plumbing problem. Okay, so this is how you should understand the difference between heart attack and cardiac arrest. So many times you might be wondering the person is very healthy and suddenly they have a cardiac arrest, and that is because of the failure of the impulses. So the cardiac arrest is an electrical problem, whereas an heart attack is a plumbing problem. So it is a simple way of differentiating between cardiac attack and heart attack in terms of electrical and plumbing problems. So whenever there is no conduction of impulses, the impulses falls below the normal. So that is going to lead to the cardiac arrest. So heart attack is due to the blockage of the arteries which supply uh, the nutrients and oxygen to the heart muscles. Whenever there is a blockage, so it results in damage of this heart muscles, and that we call it as heart attack. So angina pectoris is the heart failure is the inability of the heart to pump blood enough to meet the needs of the body. So congestion of the lungs is one of the symptoms. Okay, an acute chest pain, angina pectoris, an acute chest pain due to oxygen deficiency to heart muscles. Okay, especially the left limbs, the pain continues through. So an acute chest pain due to oxygen deficiency to heart muscles. It occurs due to improper blood flow. It is common among middle-aged and elderly people. So that completes our discussion on the circulatory system. So if you have any doubts or clarification, dear students, you can ask me and get your doubts clarified. Any doubts or clarifications? Any doubts or clarification, dear students?